Yeah. Good evening and welcome everyone to a new episode of your program Future Generations Show. Today our topic will be about medical care. First, I'd like to wish good luck for the students who have last week exams coming week. And going to our topic, I would like to first welcome Sarah. How are you, Sarah?
My name is Hannah.
Hannah, I'm sorry.
It's okay.
Yeah,
So, how are you doing?
Yeah, I'm fine.
Oh, well, yeah, as my colleague and Fred said, well, today is Tuesday, and yes, most of us are having their final exams, and yeah, good luck with that, because I think all of us were struggling and going through these hard days. May God be with all of us. And yeah, as also my friend and colleague said, is that tonight we'll have a great topic, and it's about dental care. But before we talk about that in details, I would like to welcome my friend over here. How are you?
I'm fine, thank you.
This is Sarah.
First of all, I would like to thank all the people who are watching us now. And I guess our topic today, many people just want to ask about mainly the dental cavities and our problems with our teeth. And we know that the most hurting the cavities that we have from our teeth, we know all of us that it hurts too much. And I would like to welcome also our guest today, Dr. Yasser. And I would like to know more about you as well as our colleagues. All of us, we want to know more about you.
So can you introduce yourself to us?
Thank you very much. Thank you for your welcoming.
It's our pleasure.
I'm Dr. Yasser Stas. I'm a dentist. I'm a specialist in laser in dentistry, and I have more interests in cosmetic dentistry and in oral implantology. So you can ask whatever you want about.
Can you define both of them?
Actually, the definition it will take a long time, but I can say in a few words that
you can take your time. Take your time.
It will take more time.
Okay. It's okay. Yeah.
Okay, but I can talk in a few words that dentistry in general is a field of medical science which take care about the dental health. Okay.
Definitely.
About and the mouth, the soft tissues and hard tissues, containing the bone, of course.
Definitely.
Even the bone and lips sometimes, and the relation between the mouth, teeth, and the whole face and the whole body. Yeah. Of course, because sometimes we know that some diseases in the body affect the teeth.
Definitely.
And
and
vice versa.
Yeah, exactly.
Yeah.
And we know that when just the teeth hurts, we can't stand.
We can't stand the pain.
Yeah, it's too painful.
Yeah,
I don't know.
Actually, sometimes it's very, very painful.
Even if you have a small scar on the veneer, you will feel that it hurts you, like it burns. Yeah, and is it true that water and salt are good for teeth?
Water
and salt.
No, salt.
Yeah.
Not
like warm water with some salt.
Yeah, the salt has some effect on the bacteria, on the germs.
Yeah.
Sometimes it's okay, but of course not all the time.
Not all the time. So whenever I don't know, but my grandma, I don't know. Whenever I tell her that my teeth are bleeding or something like that, or the veneer itself actually, because I have my wisdom tooth are going out, and I don't know. I face a lot of problems. It hurts, and she goes and says, "Go and wash your mouth with some hot water and salt."
Yeah,
so it works?
Sometimes, yeah.
Sometimes it does.
Yeah.
So we were talking before we started the show about that thing that everyone is doing nowadays, and I can't remember the name. I think it's the
veneers.
Veneers, yeah, that's right. So can you tell us about it? And for those who are watching us, I think a lot of us wants to know what is that and what it does.
Yeah, this is what I was talking that, okay, dentistry in general, which part of dentistry taking care about the cosmetics of the teeth, the health of the teeth and the cosmetics. Mm-hmm. Of course, as a doctor or as a dentist, we have to take care about the relation between cosmetics and
the
health of the teeth.
Yeah.
Because we don't want to make some very nice teeth, but it's not good.
Healthy, it's not healthy,
it's not healthy. Veneers is one of the very nice treatments for the shape of the teeth when it is indicated.
Oh, okay.
Yeah. But if it is not indicated, it will not help at all.
Yeah, well, actually, people,
What makes it indicate that you do need veneers?
Indication of veneers. Look, when a patient comes to our clinic, we have to see first what's his problem. Okay, if he has some problem in cosmetics, we have to define that. Okay, is it from the eruption, or something in the shape of the teeth, or some caries, decay, cavities on the teeth? This will guide us to what the field of dentistry we have to go into. Maybe we have to make veneers. Maybe we have to go to the orthodontist to make the teeth in good positions.
Yeah.
Maybe we have to make crowns, or maybe just we need some bleaching materials, which we can do it in clinic or at home.
Since you mentioned crowns, can you define that thing? Because I think people must know about that too. Is it like, does it look something like the veneers, or is it something totally different, or what is it?
The crowns are made of many materials, but in the concept of crown is that the shape which covers the tooth from all the
all the sides,
the surfaces.
Yeah.
But veneers, usually we name veneers for the very thin layer which cover the teeth only from the buccal side, from anterior side.
Yeah.
So we grind the tooth a little bit, and then we put the veneers. There is some kinds of veneers which we don't have to grind the tooth at all, or the teeth at all.
Why?
Because they are very thin, very thin.
You can't...
But sometimes, like what I told you before, what I have told you, that we have to define the problem. Then we can choose the treatment.
Okay, if you have a very thin tooth or something, how do you manage? Yani, you just put the veneer above it, or you just go and do, I don't know.
The veneer, look, if the tooth itself is very healthy, and we have to make some cosmetic treatment on the tooth, okay? And we couldn't make some bleaching because the teeth is very, very dark. So we can put a very thin layer of
the veneer?
Any material, like composite or porcelain, which is called ceramic.
Yeah.
Okay? And all of them are called veneers.
Yeah.
Okay.
And they are very thin layer, from 0.3 millimeter to 1 millimeter. So it's very thin.
Very, very
thin. Very thin.
It's made at what age, or it's general at
general
age?
General. When it is needed, so it is needed in any age.
Okay. So how do you treat that thing? I had to put a crown, but I had some problems about sensitivity, and it hurted me a lot. So I don't know if they had to remove that crown and then put it again or something like that, but.
Yeah,
they just
I will tell you something. All treatments of the dentist, if they are not needed, so they are not good. Okay, so the doctor will not go to a safe tooth, healthy tooth, and grind it to put crown, because every crown need to grind the tooth. Okay, when we grind the tooth, we remove the enamel layer, and sometimes some of the dentin layer. So we are very close to the pulp or to the nerve.
Yeah.
This is why if you don't cover it immediately with some temporary crown until the permanent crown comes from the lab, so it will hurt too much.
Definitely.
Especially with the cold and hot water. And if you have some old crown, okay, and you feel some sensitivity, this means
you should change it.
Maybe, because you will look that if there is some recession of the gingiva around the tooth, so some parts of the tooth is exposed to the hot, and this is why you feel some sensitivity.
Yeah.
Definitely.
So then you can treat the gums, or you